The central nervous system, which comprises of the brain and the spinal cord, is the most important system in human body that needs constant blood supply in order for it to function effectively. The brain alone has a very high oxygen demand. When at rest, it makes use of 1/5 of the body's total oxygen consumption. It is extremely sensitive to oxygen deprivation, in which ischemic cell death can occur in few minutes of oxygen deprivation. In this video, we will be discussing the arterial blood supply to the brain and the spinal cord. Let's first of all talk about the arterial supply to the brain. Two arteries are in charge for the blood supply to the brain. These arteries are the vertebral arteries and the internal carotid arteries. These arteries starts in the neck and then goes up to the skull, which is anatomically known as the cranium. Around the cranial vault, the terminal branches of these arteries form an anastomic circle. This anastomic circle is called the circle of Willis. It is from this circle that the different branches of arteries arise and supply the majority of the cerebrum. Other parts of the central nervous system, which are the pons and the spinal cord, are supplied by the smaller branches that are coming from the vertebral arteries. The internal carotid arteries. The internal carotid arteries originate at the bifurcation of the left and right common carotid arteries at the level of the fourth cervical vertebra. They move superiorly within the carotid sheath and get into the brain through the carotid canal of the temporal bone. They do not give out any branches to the face or neck. Once these blood vessels are in the cranial cavity, they pass anteriorly through the cavernous sinus. Distal to the cavernous sinus, each internal carotid arteries give rise to the ophthalmic artery, the posterior communicating artery, the anterior choroidal artery, and the anterior cerebral artery. The ophthalmic artery supplies the structures of the orbit. The posterior communicating artery acts as an anastomic communicating vessel in the circle of Willis. The anterior choroidal artery supplies structures in the brain that are important for motor control and vision. And the anterior cerebral artery supplies part of the cerebrum. The internal carotids then continue as the middle cerebral artery, which supplies the lateral portion of the cerebrum. Now let's talk about the vertebral arteries. The right and left vertebral arteries arise from the subclavian arteries, medial to the anterior scalene muscle. They then ascend the posterior aspect of the neck through the holes in the transverse processes of the cervical vertebra, which is known as the foramen transversarum. The vertebral arteries enter the cranial cavity through the foramen magnum. Within the cranial vault, some branches are given off, such as the meningeal branch, the anterior and posterior spinal arteries, and the posterior inferior cerebellar artery. The meningeal branch supplies the flux cerebelli, which is a sheet of dura mater. The anterior and the posterior spinal arteries supplies the spinal cord throughout the entire length of the spinal cord, while the posterior inferior cerebellar artery supplies the cerebellum. After this, the two vertebral arteries come together to form the basilar artery. A lot of branches from the basilar artery originate from here and then go on to supply the cerebellum and pons. The basilar artery terminates by bifurcating into the posterior cerebral arteries. Let's now have a detailed discussion of the circle of Willis. The terminal branches of the vertebra and the internal carotid arteries all anastomose to form the circle of Willis. Three main arteries make up the circle of Willis. These arteries are the anterior cerebral arteries, internal carotid arteries, and the posterior cerebral arteries. The anterior cerebral arteries are the terminal branches of the internal carotid arteries. The internal carotid arteries are located immediately proximal to the origin of the middle cerebral arteries, while the posterior cerebral arteries are the terminal branches of the basilar artery. In order to complete this circle of Willis, two communicating vessels are present, and these vessels are the anterior communicating artery and the posterior communicating artery. The anterior communicating artery connects the two anterior cerebral arteries, while the posterior communicating artery, which is a branch of the internal carotid, connects the internal carotid artery to the posterior cerebral artery. Let's have a look at the regional blood supply to the cerebrum. There are three cerebral arteries, which are anterior, middle, and posterior, and each of these arteries supplies different portions of the cerebrum. The anterior cerebral artery supplies the anteromedial portion of the cerebrum. The middle cerebral arteries are situated laterally, supplying the majority of the lateral part of the brain. The posterior cerebral arteries supply both the medial and the lateral parts of the posterior cerebrum. Having talked about the blood supply of the brain, let's have a look at the blood supply of the spinal cord. The spinal cord is primarily supplied by the three longitudinal arteries as it descends from the brainstem to the conus medullaris. These arteries are the anterior spinal arteries. The anterior spinal artery is formed from the branches of the vertebral arteries, traveling into the anterior median fissure. It gives rise to the sulci arteries, which enter the spinal cord. The other two arteries are the two posterior spinal arteries. They originate from the vertebral artery or the posterior inferior cerebellar artery, anastomosing with one another in the pia mater. Although below the cervical level, supply from the longitudinal arteries is insufficient, there is support through anastomosis with the segmental medullary and radicular arteries. The anterior and posterior segmental medullary arteries are derived from the spinal branches of the number of arteries before entering the vertebral canal through the intervertebral foramina. The great anterior segmental artery of Adamkiewicz reinforces the circulation of the inferior two-thirds of the spinal cord and is found on the left in the majority of individuals. The radicular arteries supply and follow the path of the anterior and posterior nerve roots. Some radicular arteries may also contribute to supplying the spinal cord. Let's discuss the clinical relevance of the blood supply to the central nervous system. There are three cases we will be looking at. The first one is stroke. The next is the internal cerebral aneurysms. And finally, the spinal cord infarction. The brain is extremely sensitive to oxygen starvation. A stroke is an acute development of neurological deficit due to disturbance in the blood supply to the brain. There are four main causes of this, and they include thrombosis, embolism, hyperfusion, and hemorrhage. Thrombosis is an obstruction of a blood vessel by a locally forming clot. Embolism is an obstruction of a blood vessel by an embolus formed somewhere else. Hypoperfusion is a lack of blood supply to the brain as a result of systemically low blood pressure. Hemorrhage is an accumulation of blood within the cranial cavity. Out of these four, the most common cause is embolism. In many patients, the atherosclerotic embolism arises from the vessels of the neck. Let's talk about intracerebral aneurysms. An aneurysm is a dilation of an artery which is greater than 50% of the normal diameter. They are most likely to happen in vessels contributing to the circle of Willis. They are very dangerous with little symptom until they finally rupture. When they rupture, the blood becomes accumulated in the subarachnoid space, leading to increased intracranial pressure. Once the arterial wall has ruptured, it is a medical emergency and the patient is most likely going to die unless treated swiftly. The treatment of an intracerebral aneurysm is surgical. As for spinal cord infarction also can be referred to as spinal stroke. It is a death of nervous tissue caused by the interruption of arterial supply. Clinical signs of spinal cord infarction include muscle weakness and paralysis with loss of reflexes. The most common causes of infarction are trauma due to vertebral fractures or dislocations, athematous disease or external compression. 95% of spinal cord ischemia events are to the anterior aspect of the spinal cord with the posterior columns preserved. Treatment is by reversal of the cause. I hope you found this video helpful. Do subscribe, like and share. See you in the next video.